House Education Policy Committees, and I'm calling it to order. Members, please take your seats. I want to welcome everybody back. I'm a little rusty, so please be patient with me today. We have a pretty full agenda, but it should go rather quickly. So first on the docket here, we have some housekeeping items. We have some minutes to approve from Wednesday, March 27th. May I have a motion to approve the minutes for March 27th? Representative Erdahl.
Thank you, Madam Chair. I move to approve the minutes of March 27th.
Representative Erdahl moves to approve the minutes of March 27th. Any discussion? Hearing none, those in favor say aye.
Aye.
Those opposed? The motion prevails and the minutes for March 27th are now approved. First bill that we have up is Representative Sandell's bill, House File 3179. We have that up for consideration today, and this is a bill that will be moving to general orders. So Representative Sandell, would you like to make the motion on your bill?
Madam Chair, I move the House File 3179 be recommended for placement on general orders.
Representative Sandell moves House 3179 be recommended for placement on the general registry. And let's see here. I believe that you have an amendment.
Madam Chair, he probably wants it to pass first.
Yes, sorry.
Representative Sandell, you might want to have the bill passed first and then refer it.
Oh,
Yeah,
thank you, Representative Erickson.
so the bill is moved in front of the committee. I believe that you have an A1 amendment, Representative Sandell.
Madam Chair, I move the A1 amendment.
Do you want to briefly just explain the A1 amendment?
The A1 amendment is a minor change in the establishment of the date of the when the bill takes effect.
Thank you, Representative Sandell. And now we have the A1 amendment in front of us. Representative Sandell has moved the A1 amendment. Is there any further discussion? Hearing none, those in favor say aye.
Aye.
Those opposed? The A1 amendment has been adopted. Now the bill's in the shape the author would like. Representative Sandell, go ahead and proceed.
Madam Chair, I'm here today to ask your support for House File 3179. It's a technical fix to a bill that was passed a couple of years ago, correcting an oversight and resulting confusion caused by the language contained in 2017 amendment to House Statute 123B, .52. I'll let Mr. McMahon and Mr. Reagan, President of the Minnesota School Bus Drivers Association, to lead you through the details of subdivisions 1, 3, and 7 of the bill. It's a little complicated and the language is arcane, but it's clean and I hope it's without controversy. I'm interested in the bill, not just because Mr. McMahon asked me to be its sponsor, but the industry has been important in my life and I expect for all of us. School transportation is a capital-intensive industry. It faces complicated logistics every day under difficult circumstances. It's highly competitive. It depends on a reliable workforce. And its clients, of course, are precious. They're our children. 3179 just clears the way to make all of that a little bit easier for those willing to provide the service. It reduces the cost for school districts, we hope, and it helps both the schools and the bus companies maintain a high level of quality service for all of our families. Mr. McMahon brought the bill to me, and he's here today to help me with some of the details and to encourage your support.
Mr. McMillan, go ahead and state your name for the record and proceed.
Great. Thank you, Madam Chair, members of the committee. My name is Scott McMahon with Flaherty and Hood here on behalf of our client, the Minnesota School Bus Operators Association. MSBOA is the association of private contractors who contract with school districts to safely and effectively get kids to and from school and activities on a daily basis during the school year. I appreciate the opportunity to chat quick about this bill. I'm going to wander you through what may be a little bit confusing, but hopefully we can get through it. Historically, under the contract provisions outlined in statute, the majority of contracts that school boards and school administrators are able to enter into are what you generally hear about with the 2+2 contracts. And those are outlined in subdivision 1 of the statute in the bill in front of you. Transportation contracts have traditionally been entered into under the authority outlined in subdivision 3, which has been on the books for years. In 2017, the legislature amended the contracting statute to add subdivision 7, which was a special contracting opportunity for food service workers. In that process, unfortunately, if you look at the bill on lines 2.20 and 2.21, the bill in 2017 added the language in there that created this exception for subdivision 7 contracts. As a result of there being the exception in subdivision 1 for subdivision 7 contracts only, it's been interpreted in the marketplace that school districts aren't allowed to contract with transportation providers using subdivision 3. So all that this bill does, it doesn't change the way things have historically operated, or it's not adding any new powers. It's simply getting us back to the way things worked in 2016 when districts and school bus operators could contract using the language of subdivision 3. So this is probably, hopefully, more than likely the most technical bill rather than substance bill that you will encounter this legislative session. So with that, I'm happy to answer any questions that members may have.
Thank you, Mr. McMullen. I know Representative Sandell has one more testifier, so maybe if you can wait in the wings and have your other testifier come up, or...
So Mr. Regan is here just in case there are questions that come up that get beyond my understanding of the bus industry.
Thank you so much for keeping us on schedule. So are there any questions for the testifiers or for Representative Sandell? Seeing none, Representative Sandell moved that the A1 amendment, we have that on the bill. So, sorry, I'm trying to find my place. Got it. The chair renews the motion that the House File 3179 as amended be recommended for placement on the general register. Is there any further discussion on the motion? All those in favor say aye. Aye. All those opposed? The motion prevails, and the House File 3179 as amended is recommended for placement on the general registry. And next,
Madam Chair and members, thanks very much.
yes, thank you. Next up, we have, let's see here. We have Representative Bennett's bill, House File 125. This is a bill that we had up last year and had some discussion around it. It was in committee on January 30th. We also included it in a policy bill. And because there were multiple opportunities to ask questions, it's really not changing that much. I'll just have Representative Bennett give some brief discussion. I believe you have an author's amendment.
I do, Madam Chair.
And then we will move on. So would you like to move your bill before us?
Thank you, Madam Chair. And I move that House File 125 be recommended for placement on the general register.
Representative Bennett moves House File 125 be recommended for placement on the general registry. Would you like to explain your DE1 amendment?
The DE1 amendment just pretty much puts it into the language that we had last year discussing in this committee and updates the dates.
Wonderful. Would you like to move your DE1 amendment?
Madam Chair, I move the DE1 amendment.
Representative Bennett moves the DE1 amendment. Any discussion on the amendment? Hearing none, those in favor say aye. Aye. Those opposed? The motion prevails. The amendment is adopted. Any further discussion or comments you'd like to make, Representative Bennett?
No, Madam Chair, I just feel like this is a good bill. It brings accountability and evidence-based type things that we do in our classroom to the groups that get grants. And I just want to say, I'll add one thing, though. I have a great example here, Educational Partnerships Coalition. I think this was from last year. I collect all these different things. They have a great example of something they're already doing where they look at, third grade proficiency reading and how they data that supports what they're doing. And I'm not even asking this fancy of a thing. It can be one sheet of paper that just a group lists its goal, strategies, data, and summarizes how they did.
Wonderful. Thank you, Representative Bennett. And thank you for bringing the idea forward in the bill. I think it's a good one, too. Is there any further discussion on the bill? Seeing none, the chair renews the motion that House File 125 as amended be recommended for placement on the general registry. Any discussion on the motion? Hearing none, all those in favor say aye. Aye. All those opposed? House File 125 moves to the general registry as amended. Thank you.
Thank you, Madam.
And- Okay, great. So members, today we're fortunate enough to have with us Dr. Jillian Peterson and Dr. James Densley, both researchers with the Violence Project, a nonpartisan think tank dedicated to reducing violence in society and improving policy and practice through research and analysis. Dr. Peterson is an assistant professor of criminology at Hamline University, and Dr. Densley is a professor of criminal justice at Metropolitan State University. Professors, thank you so much for being here today, and please introduce yourself for the record.
Absolutely. Thanks so much for having us. So I'm Jillian Peterson. I'm a professor of criminology and criminal justice at Hamline University, and I'm a psychologist by training.
And Madam Chair, Committee, thanks for having me. I'm James Densley, and I'm Professor of Criminal Justice at Metropolitan State University, and I'm a sociologist by training. So we're here today to talk about some research that we've been conducting over the last couple of years, focused on mass shootings in the United States, and the implications that that has for educational policy and practice. And we know that this is a large debate nationally. There's increased fear around school shootings amongst school children, amongst school teachers, amongst parents. And often we are trying to affect change in ways which may actually be counterintuitive to the goal of reducing violence in schools, and that we are maybe doing things which are not well grounded in the evidence. And so our goal here today is to provide some of that evidence that we can make some of those decisions. And I think what we really want you all to come away with today is that when we think about prevention of school shooting, it is different to reaction when a shooting occurs. We want to focus our efforts on prevention. So we think about school shooting prevention as not just active shooter drills, run, fight, hide, and other phenomena in that area. We want to put a different emphasis on things, which hopefully you'll see when we go through this. And I also want to just highlight that everything we talk about today, we believe has a wider diffusion of benefits. So here we are with an education committee, and you're probably thinking, well, what are the mass shooting researchers doing here? Well, we think the things that we talk about today will also actually affect violence, bullying, school climate. They will prevent suicides, and other aspects which impact the lives of young people in our schools. And so we see this research as having a diffusion of benefits across all those different areas.
So what we've done over the last couple of years is build a database of mass shooters in the United States. And it's actually now publicly available as of a couple months ago on our website. You can actually download the entire thing. So it currently has 171 mass shooters in the database, and they are coded on over 100 different life history variables. So anything from their early childhood, their adolescence, their parents, their social media use, their risk factors, their warning signs, anything that we could find, we put together, with the goal being we can't really get at preventing something until we really understand why it's occurring. And the idea is if we put all this data together, can we come up with more evidence-based and data-driven prevention strategies? And I should say this project was funded with a large grant from the U.S. Department of Justice, and the database was built all by undergraduate students at Hamline University. And then the second piece of this project was we've been conducting interviews. So we've conducted interviews with living perpetrators of mass shootings who are incarcerated. We've been exchanging letters. We've interviewed their families, their parents, their siblings, their old teachers, to try to really get an in-depth look at what gets a person to the point of doing this, and focused on kind of the weeks and months ahead of time, what could we do different and what could have intervened to stop it from happening. So the definition that we used in our database, which is the kind of federal government's definition, is a mass shooting is when 4 or more people are killed in a public location. And today I'm also going to be talking about some findings from an extension of this work that looks specifically at school shootings in K through 12 schools. And in that case, we did mass shootings, but also attempted mass shootings. So we looked at instances where someone came into the school heavily armed with the goal of shooting indiscriminately at multiple people, even if 4 more weren't actually killed. So from this work, from building this massive database and interviewing all these people, we put together this model that's really based on the data. And I would say we can't come up with some checklist of here's what creates a mass shooter, and if you just check off these things, you can predict it. What we do see is this common pathway in these individuals' lives. And this we see again and again. So the first piece being trauma, early childhood trauma, early exposure to violence, physical and sexual abuse. The second piece being that perpetrators of mass shootings hit an identifiable crisis point and people around them notice it. So it's about 80 to 90% people say we knew they were in crisis. There was a change in their behavior. Something happened that kind of pushed them over the edge. And then they often, almost all the time, become suicidal. And that these really are suicides in addition to being homicides. It's very rare to have an exit plan when you go in to do a school shooting. The third is script and validation, which we'll talk more about, but shooters study other shooters. They research online. They get radicalized in online hate groups. And then the fourth piece being access and ability. So access to firearms and then access to the building that they've chosen. And we think that based on this model, prevention can happen at each of these 4 steps. Currently, our focus up until this point has really been on access and ability. Let's make it so it's hard to get into the school, it's hard to get your hand on weapons, that people know how to minimize casualties once it happens. We're kind of assuming it's just going to happen. How do we react? We're saying let's intervene earlier at trauma and abuse, at crisis and suicidality, and at script and validation. So the first piece of this is that school mass shooters experience abuse, neglect, and early exposure to trauma and violence. These are some examples. I won't read through them all, but this was very serious abuse, serious exposure to violence. We actually ended up adding a code in the database for a parent who committed suicide because it was so common in the life histories of these perpetrators. So the first thing that we see coming out of here in terms of prevention is that counselors are important, that these are kids that are on the radar early on for having really intense exposure to violence, and that early intervention and counselors and mental health access in the school could be really important. The second key finding here is that over 90% of school mass shooters are current or former students of the school. And in fact, this is our little chart, 77% are current students. So if you just take that alone, right, these are current students of the school. When we spend millions of dollars on things like school security and doors, these are students going in and out of those doors every day who are perfectly well aware of the security infrastructure and the procedures. This shows the age distribution. The vast majority are 12 to 21, the average age being around 15. So if school shooters are insiders, it actually makes prevention a lot harder. I think we've been approaching school mass shooters as though they are outsiders trying to break into these schools and do this. And so if we can just build strong enough doors, where the reality is these are kids who are in the school, in and out of the school every day. They're also kids that are running through the exact same lockdown drills as everybody else. So if the perpetrator's in the school, they've been going through 5 lockdown drills a year, through 5 active shooter drills. They know exactly how the school is going to respond. And we've seen that that inside knowledge can actually be used to increase casualties rather than decrease them. We're also, I think as a psychologist, I am concerned about repeatedly running through active shooter drills from a very young age, what that can do to actually distribute this script to young kids and have them act it out over and over and over again. Can we be triggering a fascination in kids that wouldn't necessarily be there? And we know the 2 largest teachers unions in the country just came out kind of saying that we need to take a hard look at lockdown and active shooter drills in schools. And I've done some of my own research on the impact of active shooter drills. We're seeing more and more of this research emerge now that shows that for vulnerable kids and even non-vulnerable kids, that these drills can be very traumatizing and have significant mental health impacts. They increase anxiety, they increase fear, they increase students feeling that this is going to happen to them in school, and there's more and more research emerging out of there. So we know that it increases fear, increases risk, and also it makes you feel unsafe at school. And we know that school culture is actually a really important thing. A positive school culture is really important in terms of violence prevention. Oh, sure. Yes, I'll keep going. We also know that 80% of school mass shooters were in a mental health crisis prior to their attacks. So this means that something changed, something happened, and they are overwhelmed. We define a crisis as any time your current situation overwhelms your ability to cope. A lot of times it was a breakup with a girlfriend, or something happened at school, or rejection. So for this reason, we think that all staff in school should be really trained in how to spot a crisis, what are the behavioral signs of a crisis, how to intervene, how to do things like crisis intervention, de-escalation, and suicide prevention. And our research would show it should be everybody in the school. In some cases that we studied of averted mass shootings, it was the janitor that talked the student down, or it was the lunch lady. It doesn't necessarily happen just in the counseling office. So making sure that everyone from the shop teacher to the receptionist knows how to spot when a kid is off, when there's a change in behavior, and what questions to ask, what to say and do with your body to elicit that response and to de-escalate that student. This is a process that we put together for crisis intervention, which has to do with kind of regulating yourself, regulating the space, and verbal and nonverbal strategies that can be used. We see this almost like CPR. It's a skill that can save lives, that everybody should be very well versed in, and I would love to see everybody in a school as trained in crisis intervention and suicide prevention and de-escalation as they are trained in run, hide, fight, if we're really going to start preventing this from happening. Our data also shows that the most common months for school mass shootings are May and September. So the very start of the school year and the very end of the school year, which is the time when school is kind of most stressful. There's the most transitions where you see kids kind of in crisis because of the change of what's happening in the environment.
So the other thing our data show is that many of these shootings were not a surprise. 80% of the time, these shooters had leaked information in advance, whether it was to other teachers, to parents, or to others. But what was happening is that no one quite knew who to talk to and who to share that information from. We have this sort of mantra around, if you see something, say something, but you also have to do something. And so with this, we believe that schools would benefit from a coordinated anonymous reporting system. And there are examples of these where not just teachers, but also fellow students and peers could also make this, or you could self-report. Not that you're going to be the next mass shooter, but just that you are in crisis and that you need help. There are models about this throughout the country. There are some companies that have software, for instance, that helps facilitate this on local campuses. But Sandy Hook Promise has a crisis center in Miami, and also the legislature in Pennsylvania passed a law where they would have a statewide mandate that the schools would be referring to a statewide crisis center that would be referring people to the help and support that they needed. We kind of already touched on this, but I think this is important. We think about the suicide crisis that we have throughout our country and amongst young people. We see that school shooters are actively suicidal prior to their attacks, and that actually a third of them die in the act. Many of them intend to die in the act. And you can see this in lots of examples of the data. This is the hearing of one of the first school shooters who says, why did you perpetrate the shooting? And she says, well, I was trying to die. And it was, well, then why did you pick the school? And it was, well, I knew the police would show up and they'd try and shoot and kill me. This was a suicide. And we see this also in the interviews that we've conducted, that people were active suicidal before the event, people who tried to take their own lives. This has important implications when we think about some of the things we're doing in our schools around threats. Because at the moment, the template for threat assessment is often that it's a very punitive response. It's often a very law enforcement heavy response. And there's not a sort of an appropriate intervention for those young people to get the help that they need. When you also want to think about this, punitive measures are ineffective if someone's suicidal. So when we think about some examples of maybe we want armed guards in schools and security measures, that might actually be part of the incentive to go to the school to perpetrate the shooting if you are suicidal. So there are some challenges here about the way in which we structure this, and we need to be thinking about punishing threats could be exacerbating grievances, and it could be putting people on the pathway to violence. Last couple of things here is that school shooters study other school shooters, and a third of them purposely studied Columbine. We could talk about this all day and what it means, but the bottom line is this: we need media literacy in our schools. Young people are getting radicalized online, and again, we talk about diffusion of benefits. Using social media and all the issues that are related to that, this is important when we think about how we intervene with this type of violence as well. This is an education committee. We talk about firearms, everyone tenses up. But the reality is 80% of school mass shooters get their weapons from family members. We can see this in our data here, how it's broken down. The vast majority get it directly from their parents. If they don't get it from their parents, it's from their grandparents. So what does this mean? We think it means an opportunity for bipartisan, equal opportunity response to this issue. If we understand that shooters are getting their firearms from their parents at home, then we need a public health campaign around safe storage of firearms. There are ways you can do this which are more controversial than others. So for example, in California, they actually will criminally charge parents who fail to safely store their firearms in the home. Now, I appreciate that that might be an extreme measure that might not pass muster in Minnesota. But at the very least, a public health campaign within schools, sending letters to every parent in every Minnesota school district, encouraging them to practice safe storage and providing them with resources to do so could be an important next step. The final thing here is schools need very clear lines of referral, who is to do what when to prevent these types of crimes. They need formal in-house intervention teams to research and assess student needs, to recognize those concerns, and to respond accordingly. We've built a model, we call it the R model, for how this would operate on a school level. But in other jurisdictions, they call them threat assessment teams and other aspects as well. We want to really advocate thinking strategically about what that looks like, how it's funded, and how it's coordinated. So, in summary, we believe that the data, and that's what's driving this, there's not a sort of political agenda here. This is just data-driven. It's telling us that we need to stop funding and mandating active shooter drills, hardening schools, and punishing threats. But where we can put our time and resources and our effort is in school counselors, crisis intervention training, anonymous reporting system, maybe even on a statewide level, intervention teams within schools, media literacy, and the safe storage of firearms. And with that, Thank you.
I want to thank you both very much for your work on this and the data-driven approach that you've taken. We started a little bit late, so we have about 10 minutes for questions, and then we have 2 more bills up. But I have Representative Gruenhagen on the list first.
Oh, thank you, Madam Chair. And thank you, Dr. Peterson, Dr. Densley, for your presentation and your concern. In all your data that you collected, did you find out how many of these shooters were using psychotropic drugs during the time of their shooting?
Yeah.
Yes, we did code that. And it's about 20%, which is about the same as the percentage in the general population.
Thank you. Representative Gruenhagen, one quick follow-up?
Yep, one quick thought. The reason I say that is I've been doing a lot of research as a layperson on it. One of the books I've read is Destructive Trends in Mental Health, The Well-Intentioned Path to Harm, which was co-authored by the former president of the APA. And in there's 2 chapters in particular. One is warning, psychiatry can be hazardous to your mental health. The second one is the diseasing of the American children. I have strong convictions that we are way over-medicating with psychotropic drugs our K-12 population. France is about 0.5%. Other countries are much less percent. We're at 10 to 12%. And we know that the use of these has devastating consequences long-term because the military you cannot get into, and I talked to several recruiters over the years, without a medical waiver, because one of the consequences of long-term use of psychotropic drugs on developing children past 12 years old is violent outbursts of uncontrollable rage. Do you want somebody with a loaded weapon in the military with a violent outburst of uncontrollable rage? You probably don't want that. Okay?
Representative Gruenhagen, we've got a long list, so
Yeah, I know.
I'm going to wrap it up here.
In closing, Dr. Chris Foley and myself authored this past year in the Minnesota Physician, which goes to all medical professionals in the state, an article, which I'll go up and get you a copy of, that addresses this. And of course, psychotropic drugs produce an increase in suicidal thoughts. And I question your 20%. I think it's closer to 70 to 80% of the shooters. I know Columbine were on psychotropic drugs, Sandy Hook, and a number of other ones. They were using psychotropic drugs. Please consider that, and let's stop abusing our children with the use of these drugs that have devastating consequences.
Thank you, Representative Gruenhagen, and thanks again for the data-driven approach that you've taken. Representative Moeller.
Thank you, Madam Chair, and I just wanted to thank you both for coming today. I had the opportunity to attend your full-day hearing during the interim, and you did an excellent job of paring down a full day's worth of training into this shorter presentation. But I also just wanted to let you know that I attended a national conference of state legislators suicide prevention convening also, and that I can tell you that Minnesota is lagging behind what other states are doing. I am definitely interested in anonymous reporting, and first I'm wondering what other states do you know of that have that?
Yeah, so it's Pennsylvania, right? That's
Pennsylvania is the only one with a statewide mandate.
Okay.
Colorado has a pretty good system in place, but I think it's sort of school by school or district by district.
Thank you, Dr. Peterson. Oh, sorry, Dr.
Oh, I'm sorry.
Sorry, go ahead.
And I think, so the Sandy Hook Crisis Center is based in Miami, Florida. But they partner with school districts throughout the country that sort of plug into that particular crisis center. So you have some states which have passed a full statewide mandate, and then other states which are operating their own local systems. And then you have this kind of national system that you can sort of buy into, if that makes sense.
Hey, Representative Mueller, any follow-up?
Yes, just one other quick question here. We do have a number of bills that we'll be hearing this session on surrounding mental health and our students. And I think, Dr. Peterson, there was one example you gave at the full-day training that I'd love for you to share with the other members about your own situation in a classroom with a student and your de-escalation techniques used there.
Dr. Peterson, if you could quickly
I'll be fast.
answer. Thank you.
So I had a student come into my classroom and kind of threw her, I teach college, and she kind of threw her paper at my head and said, here's your effing paper, and went to her seat and threw her head down on her desk. And this is really unusual behavior for her. It was out of character. So I knelt beside her and asked her and used all the techniques that I had learned through all this training, knelt down next to her so I was below eye level, which is really important, use a calm voice, asked her to step in the hallway with me. She said yes. Had she said no, I would have cleared the classroom and gotten everyone else in the hallway. Once I got out there, was able to just kind of say, hey, what's going on? She was able to kind of collapse into sobs. And then I gave her two choices, two very specific choices, which were, do you want to go in and get your own backpack to go to the counseling center, or do you want me to go and get your backpack to go to the counseling center? So she felt like she was making that choice. She said, I want you to go get my backpack, and then we went to the counseling center. So there's a lot of those techniques that are really teachable that a lot of we're just not giving people. It's a very doable technique.
Thank you. Thank you. Representative Bennett.
Thank you, Madam Chair. Could you just, and thank you for this presentation, very interesting. Could you just explain briefly what you mean by media literacy can help disrupt the cycle of violence?
Dr. Peterson, or Densley, sorry.
Sure. Yeah, that's a great question. So I think what we see is that a lot of young people are being exposed to content, particularly on the internet, that they don't fully understand the complexity of and what it really stands for and what it means. And so it's a way of sort of thinking about how we can disrupt the kind of radicalization process, not just in terms of content around Columbine. There's lots of Columbine memes and chat rooms and stuff. We see a consistent theme in our data about young people finding those types of websites and becoming sort of obsessed with them. So work around that area, but it feeds into a broader agenda around like the sort of alt-right conspiracy theorists that are out there on the internet, understanding those types of websites and platforms and what is propaganda and what is not propaganda, understanding fake news, all those types of things. Because we see for some of these individuals that go on to perpetrate these shootings, they get very much sucked into that world online. And I think it's really important for young people to better understand it.
Okay, I've got Representative Kunesh-Bodine, then Erdahl, Waslowik, Erickson Scott, and then Mariani, and then we're going to have to move on, even though we could probably talk about this all day. So Representative Kunesh-Bodine.
Thank you, Madam Chair. And I'll make it quick. I am a middle school teacher myself. 2 weeks ago, I was in my school, and I understand a lot of what you are saying to be the truth of the matter. The way that you spoke to that student, those are some of the skills that I've learned more through trial and error. But I think it's really important that our schools and our community as a whole are providing those kind of training and are doing it by example. So, and when you spoke about the social media, a lot of those things, I'm a library media specialist, and so I taught in the elementary school, and we taught a lot of those literacy and being able to discern between the good websites, the bad websites, and the ability for students to realize that they are being influenced either negatively or positively in that. And I think that's really an important part of our education in this day and age. Just really quick, would you just speak to the value of a school culture to the well-being of not only the students, but also the educators?
Who would like to take that?
Sure.
Dr. Densley?
You want to do it?
No,
Sure.
Dr.
I think we're going to tell the same story.
Yeah, so very quick story. We spoke to one principal who stopped a mass shooting. So there was actually a student that came into the bathroom and had built 2 rifles in the bathroom, and another student walked in and saw him, ran into the hallway, and this was before the school day had started. And he said we had done lockdown drills, but we had never done a drill before the school day started. There was kids in the cafeteria, no one knew where anyone was. The principal walked into that bathroom and managed to talk that student down. He knew his name. He just said, we're not doing this today. The school resource officer happened to be off-site at a training, right? Just like everything was a disaster. And so when we asked him, how do you prevent a school mass shooting, having been through that and having stopped one single-handedly, he said, I have one word, and it's relationships. Relationships is what stops a school mass shooting. If you don't have those strong, healthy relationships, that's not school safety.
Thank you. Representative Erdahl.
Thank you, Madam Chair and testifiers. First of all, I commend you for your report, for your research. I think that a lot of what you say is true in terms of what needs to be done to prevent these types of things from happening. But having said that, I have one little caveat. I am the author of the school lockdown legislation in Minnesota. And I was a teacher for 35 years. And I once asked, after Columbine, I asked my students in the lunchroom, I said, so if a shooter walked in here today, what would you do? And they said, scream and dive under the tables, which is exactly what they did at Columbine. And so it came to me as a teacher who in those first days only had a, well, our lockdown drill wasn't a lockdown drill. It was workshop in the fall, no students anywhere. It was the teachers who did the lockdown by themselves. And it simply seemed logical to me that these kids don't know what to do. So if what you have been talking about regarding prevention and everything, if that fails, what do the kids do? If a shooter walks into the lunchroom, they don't know. If it happens before school, and in my bill I emphasize it should be different times of the day that you have some type of drill, because otherwise, again, it's mass chaos. If only the teacher knows, the teacher can't convey this. I talked to psychologists who assured me that young children, if properly prepared, could handle this. I talked to law enforcement about the fact that it isn't just practice, the drills aren't practice for a future shooter to know how to do it, but that if someone wants to shoot, they don't need to know how the drill works in the school. They're going to find a way to do it anyway. And so, you know, with these things in mind, I'm just wondering, to answer, I guess, the question that I posed earlier, if all these great efforts at prevention don't work, what do we do if there are no drills?
Representative, sorry, I demoted you, Dr. Peterson or Dr. Densley.
I think this is really hard, right? Because I think you understand that line of thinking. You want, it's worst case scenario, if it does happen, you want the fewest people to die and you want people to know what to do. I think I can only answer from the data, and I'm not law enforcement. I don't know how to correctly respond. We have interviewed people from the FBI who have been on the sites of school shootings who say that you can't train for it. And sometimes even thinking you can train for it hurts you when it does happen. That the best things you can do is have strong communication, have students who know to listen to their teachers in a case of an emergency. I think all we have, as we're researchers and we say the data shows that the people that do this are kids in the school. So the perpetrators are running through all this preparation. Are we sure that that's not creating a fascination? We know in some cases it's increasing casualties because they know how students are going to respond. I do think it's really difficult, though. I can absolutely see the other side of it. I don't have great answers.
Yeah, and I just would like to add, if possible, I think it also depends on the nature of the drill itself. So you can have a lockdown drill, which is, you know, you get medical lockdowns and stuff like that as well, which is very different to what some of the active shooter drills, where people bring in paid actors to lie dead, covered in blood in the hallway so that kids can prepare themselves for what it looks like when there's dead bodies. That's problematic. You know, or using pellet guns to shoot at teachers so they understand what it's like to be in the line of fire. Those types of aspects, and I'm not making this up, this is real. So I think it's also a question of how are those drills being ran and for what end? What are we trying to achieve with the drill? I will also say the case of the principal we mentioned earlier who talked down an active shooter in the building, that occurred at 7:30 in the morning. And he mentioned very vividly that the marching band was on the field at the time and people were congregating in the cafeteria. This was a school that had ran countless active shooter drills. And they said they were irrelevant because we didn't know who was in the building. We had no idea at that time what was going to happen. And so it's a real challenge to figure out how you get that balance right. And I think there's a right way to do it. And unfortunately, I think a lot of schools have taken it to an extreme, and there's now a wrong way to do it, and we see that too often.
Thank you. Representative Waslick.
Thank you, Madam Chair. Just a quick question. I know in the things you said that occurred commonly with mass shooters, I'm wondering if you could speak to domestic violence. We hear a lot that this is something that might precipitate a mass shooting, or that there's a history of that in kind of the history of the mass shooter, not just seeing it or witnessing it, but also perpetrating it. I'm wondering if you could speak to that.
Yeah, so I
Peterson?
think one thing that happens is it depends on how you define a mass shooting. So the most common type of mass shooting in this country is when someone kills their family and themselves. A family annihilation is the most common. We did not include those in our database because it's kind of a different profile and so if you include those, absolutely the number one predictor is domestic violence. If you exclude those, the domestic violence prediction kind of falls away. We do see a history of violence being very common. We see a criminal history being very common. Up to 60-70% have a history of violence. We are actually currently trying to pull out domestic violence from that to really get good numbers. But a lot of that comes down to definition.
Thank you. Representative Scott.
I'll pass, Madam Chair.
Thank you. Representative Erickson.
Thank you, Madam Chair, and thank you for your presentation. I'm looking at slides 11 and 12, and in your interviews, reference was made to fathers or some male. And my concern over the years has been that we have diminished our ability to help our boys as they grow up in both family and in school to understand their responsibilities and their roles, and to help them learn some skills when it comes to falling in love, for example. I mean, we get these crushes early. So how do they react to rejection and to breakups? Because I know that forces young men to do some things they probably wouldn't do if they were given some skills. So anyway, looking at your reasons, children need counselors, I would say we need to focus on our educational systems, on our boys, raising them, and in our families as well. And then I would like to see parents involved in the lives of our children to the extent which we can't pass policy to force parenting, but we can pass policies that empower parents. And then finally, some schools today are having all staff, whether you're a custodian or a teacher or an administrator, adopt a student. And therefore, that relationship begins. And I've been suggesting that to all my schools when they bring up consternation over behaviors. I've said, well, have all staff adopt a student, and they can then watch that behavior. And if there's a change, like you addressed the student in your classroom, that can happen. So just a thought about, as we move through the future, focusing on our boys and raising them and teaching them skills, and then empowering parents through our policy. Thank you.
Did Dr. Peterson, Dr. Hensley, did you want to add anything to that?
Oh, just to say that, yes, the vast majority of the shooters are male, and so there's definitely something around kind of masculinity and how men respond to grievances and to slights in their lives that's really important to this. So I think that's great. And the idea of having this, sort of mentoring within schools or building those relationships with adults and children, I think, we would fully support that. It speaks to the earlier question around school climate, I think, really important.
Yes, and I think you're going to love the social emotional learning bill I have then.
Yes. That's what I was going to say, social emotional learning.
Social emotional learning.
Thank you. Representative Mariani, you have the last word, and then we'll move on.
Thank you, Madam Chair. And first of all, thank you for doctors for coming and sharing data-informed sharings with us. And I'm looking forward to your testimony in my committee, the one I chair on Thursday. I apologize, I missed out on our briefing this morning, but Jamel will fill me in, no doubt. I have a lot of questions. Some of them were covered, and we don't have the time to do this. I'll try to be real concise. It seems to me that I was really struck by the 77% number. And, for me, it's so much easier to default to thinking about monsters outside of my home, outside of my community, outside of my way of thinking, blame the monsters. And I actually do think monsters do exist. But that's primarily what we're not talking about here. We're talking, if monsters are like something other than us, it sounds like we're talking about us. We're talking about our kids. And so therefore, absolutely good to have, I think, rapid response, abilities. But my concern is that by focusing on those issues, we then detract away from focusing on where we can make the greatest prevention good, because the goal should be to prevent deaths. And we also detract away from building relationships. So I love Representative Kunesh-Podein's question. And all that, by the way, Madam Chair, all of that takes resources. It's one thing to say, I expect parents to raise their boys well. It's another thing, quite frankly, for us to actually invest in parent skill building opportunities in the schools where the kids are at. And that doesn't happen without resources. And so, wishing and actually following up with something are two different things. But here's my quick question, because I have so many. School resource officers, and maybe there's a tie-in back to the relationship issues here. I've been terribly worried about SROs, not in all instances, but the question objectively is, if schools are using SROs, one, what should they be doing relative to what your data is telling you we should be doing? And two, what alternatives could exist aside from having yet another law enforcement presence inside our schools?
Either doctors, Dr. Densley, Dr. Peterson?
I'll start. So I just wanted to comment on what you said at the beginning, because I think one thing that we would like to get across is that a lot of times we've been thinking about there's safety and there's public safety, there's school safety, and then there's mental health and student well-being, and that student mental health and well-being is public safety, and that we should be funding it like we fund strong doors, right? That it's actually probably more effective in terms of prevention. For school resource officers, there was somebody armed on the scene in about 50% of school mass shootings, so it's not the deterrent that we hope it would be. Sometimes they took down the shooter, sometimes the shooter got the gun from them. It was kind of, you couldn't see a consistent, like when there's a school resource officer, there's fewer casualties. We didn't see that relationship in the data.
Dr. Densley?
I would just add as well, I think your question is really important to think about, because in society in general, I think we've made the police become the sort of first response to so many crises that we have, and we know that there's a broader conversation now about how police should be responding to mental health crises in the community, and how police and community interactions are, and all these broader debates around policing. And it speaks to SROs. We've got to ask ourselves, is the SRO the right tool for whatever it is that we're trying to achieve with that relationship? And we now see a lot of, in the community, co-responder models where we have social workers partnered with police officers, and crisis intervention centers, and all this type of thing. Is that same work being sort of transferred into the school environment when you think about what we want those individuals to be doing? So it's a great question.
Once again, I just want to thank you both for coming here and all the work you've done. I really appreciate the data-driven approach. I know a lot of more people probably have questions to take offline with you, and we'll make sure that we get your PowerPoint up. I apologize if it wasn't up ahead of time, but we'll make sure PowerPoints are posted on the website once we get them. And thank you again. And up next, we have, Representative Edelson, we got started a little bit late. I know you have two bills up, and we have a presentation from Clearway. So if we could have Clearway come up and be as concise as possible, because we want to talk about this other important topic that affects the health and well-being of our students in our schools, and the rapid rise in the use of e-cigarettes, also known as vaping. And after that, Representative Edelson has two bills up, and she has some testifiers who will testify to both bills, and then we will take action on the bills. So please go ahead, state your name for the record, and proceed.
Thank you, Madam Chair and members. Thank you very much for inviting us to testify on the youth e-cigarette epidemic. My name is Molly Moynihan, and I'm Vice President at Cleary, Minnesota, and I also co-chair Minnesotans for a Smoke-Free Generation. We're a coalition of 60 organizations from health groups, nonprofits, and education partners. We appreciate the committee taking time today to learn more about the tobacco epidemic affecting schools, students, and communities across the state.
Ms. Marlene, can you make sure that you pull the mic just a little bit closer? Perfect.
Absolutely. There you go. In 2018, the current U.S. Surgeon General declared youth nicotine addiction an epidemic after e-cigarette use rose faster than any other drug use recorded in 40 years. Youth e-cigarette use is a complex health crisis requiring a comprehensive response. Today, we will quickly summarize the health threat, provide examples of how this issue affects the educational environment, and allow time for questions. While youth cigarette smoking is at historic lows, rising e-cigarette rates have erased nearly 2 decades of progress to reduce youth tobacco use. In 2019, more than a quarter of Minnesota 11th graders and more than 1 in 10 8th graders reported vaping. Minnesota's 8th grade vaping rate nearly doubled only in 3 years. Schools and communities are facing a major health crisis, which is fueled by Juul and other big tobacco brands. Juul is largely, if not completely, responsible for starting this crisis. And I wanted to point out what a Juul is, and we can pass around these products if folks want to see them up close. So this is a Juul, and these are the Juul pods. The company, which is now partly owned by Altria or Philip Morris, which is maker of Marlboro cigarettes, targeted kids as young as 8 with school programs, summer camps, and thousands of social media influencers. Its models were young, its ads were colorful, and its products were candy-flavored, easy to hide, and highly, highly addictive. The federal government has nearly complete authority to regulate all tobacco products, including e-cigarettes. Recently, they have taken some steps, but they could do so much more. In late December, Congress passed and the President signed into law a national tobacco 21 age, a step we applaud and celebrate. It's now against federal law to sell tobacco products to anyone under 21. In January, the FDA announced an extremely watered-down policy on flavored e-cigarettes. Last September, the President promised to clear the market of all these products, but his proposal only ended up being a temporary ban on some candy-flavored e-cigarette pods. There are thousands of flavored e-cigarettes still on the market. E-cigarette liquid was not affected, leaving huge bottles of vape juice, like this bottle of Unicorn Drop, still on the market. Refillable pods, like the Soren and the Smoke, still on the market. Disposables, like this Puff Bar, still on the market. These come in flavors like pink lemonade, OMG, orange mango guava, and this one's watermelon. Disposable with as much nicotine as 3 packs of cigarettes. And should I add that Minnesota retailers are not all following the federal Tobacco 21 law, since our state has not adopted a state Tobacco 21 law. Our kids can't wait for Washington, D.C. to catch up. Minnesota communities have already stepped up in a large way, but we need state legislative action. We're united behind 4 major goals to reduce youth use: increasing prices, raising the sales age, prohibiting the sale of flavored tobacco products, and investing in prevention and cessation. As session gets underway, please keep these in mind as you consider the different proposals in front of you. Thank you.
Thank you, Ms. Marlene. And Ms. Vital, would you state your name for the record and proceed?
Yes, my name is Latricia Vital, and I am the Director of Policy and Advocacy at North Point Health and Wellness Center in North Minneapolis, and I also serve as the Vice President of the Minneapolis Park and Recreation Board. As a part of the work that I do around tobacco prevention at North Point, it currently provides training at 6 schools in North Minneapolis: North Community High School, Patrick Henry High School, Lucy Laney, and Watton, Jefferson, and Hmong International Academy. In communities of color and other diverse communities, menthol cigarettes like Newport, I'm sure you all have seen these before, and little cigars like Swisher Sweets, they're still a huge problem. These products are lower priced They come in appealing flavors and are heavily marketed towards youth, African Americans, and the LGBTQ communities. E-cigarette use is also becoming widespread. Just a couple of weeks ago, I spoke to a group of middle school students and asked if any of them had used e-cigarettes or knows someone who does. Every single student raised their hand. Every single student raised their hand. I've worked in tobacco prevention for over 15 years, and I was floored. It is hard to floor me. I was floored. I could not believe the responses that I got from these middle schoolers. This epidemic has truly taken over in communities around our state. Our kids should be growing up strong and free from addiction, but they have been relentlessly targeted by the same industry that hooks so many of our parents and our grandparents on cigarettes. The 2019 Minnesota Student Survey showed that e-cigarette rates are through the roof, especially for some of our most vulnerable students. Current use of tobacco products among bisexual students is 41%. Use by American Indian students is at 28%. Tobacco use by students facing severe economic hardships is at 41%. And finally, among those students bullied daily, 43% of them are using tobacco products. We can't sit by and let this happen to this generation. Thanks to the good work of the Menthol Coalition and other groups, we have paved the way in Minneapolis, St. Paul, Duluth, and dozens of other cities around the state for bold action on restricting flavors and raising the tobacco age. I implore you to go above and beyond this legislative session and to stand up for all our kids. Thank you very much.
Thank you, Ms. Vita. We have Sue Nickleby next, and then Carrie Huntunen, and then a student group. And I want to give time for the students to talk, so if the adults can talk quicker, that would be great.
Good afternoon,
State your name for the
Madam.
record.
Yep, thank you. Good afternoon, Madam Chair, Joachim, and committee members. I am Sue Knuckleby, the past president of the School Nurse Organization of Minnesota. Reducing smoking, especially in youth, was one of the greatest health achievements of our lifetime. However, the progress has been swiftly erased and has surpassed earlier youth rates of smoking by the introduction of e-cigarettes and vaping. The 2019 student survey found that 3/4 of Minnesota students didn't think that vaping was risky. Far too many of our young people don't understand the dangers of e-cigarettes or underestimate their addictive value. The e-cigarettes that are popular among students have very high contents of nicotine. For example, each Juul pod contains more nicotine than an entire pack of cigarettes. Some teens are going through multiple Juul packs a day, which is extremely high nicotine dosing. As a result, we are seeing nicotine withdrawal, attention and learning issues, even examples of nicotine poisoning called Nic Sick. This year, one school district sent 2 students by ambulance having seizures due to nicotine poisoning. No amount of nicotine is safe for our youth. No matter how it's delivered, nicotine is addictive, harmful to the adolescent brain, and could predispose addiction to other substances. Vaping flavors that have been approved by the FDA for ingestion are not improved for inhalation. These flavors in e-cigarettes cause damage to airways and lung tissue. Lungs are far more delicate than the GI system. The tobacco industry has ramped up the marketing of e-cigarettes to youth in many ways, mostly by making vaping cool with high-tech, easily hidden vaping devices and fun flavors. These flavors are very appealing to youth. The devices can look like USB drives, pens, phone batteries, bracelets. There's even a hoodie with the strings that have the vaping device in them. Students who would never consider smoking cigarettes readily pick up on vaping. Make no mistake, vaping in youth is a public health crisis. It's addicting a generation of smokers who will suffer from that addiction. I found actually a vaping device right outside my garage last night, and it says blow on it, and on the other side it's really a funky kind of print. I do not think that these are for marketing for adults to stop smoking. Finally, underpinning this crisis is a systemic lack of student support and resources. As you consider the e-cigarette crisis and other educational issues this session, it's important to acknowledge that our students are facing serious mental health and social challenges. These struggles make our students vulnerable. The tobacco industry has seized upon this to addict a generation. School nurses will continue to do everything possible to keep up, but we need robust policies and resources to keep our children safe from e-cigarettes and many other challenges.
Thank you, Ms. Dickleby. And will you please state your name for the record? And
I will. Thank you, Chair. Madam Chair, and thank you, committee, for giving us this opportunity. My name is Carrie Juntanen, and I have been in education for 37 years. And I served in Hermantown since 1999 as a teacher, a coach, middle school dean of students, middle school principal, and now for the last 5 years as the superintendent of schools. And I have a lot of comments here, but I hear you. You want to hear from the students. So I'm going to just really distill this down, but I would like to add this to your record if you might.
Yes.
I've seen firsthand how e-cigarettes are easy for students to get and easy for students to have in their pockets. I thought this was an iPod when the principal gave it to me. This is one of the instruments they use, and you've already seen some of these. They're very hard to detect. You heard that we have kids sucking on a string. We thought that they were hoodie strings. And when we talked to the kids, they said they had taken the string out of the one that came on the sweatshirt that makes it seem like it's part of it's tobacco, and so you can all see it. But when it's a hoodie string, you can't tell that that's what that is. And so when I was the dean of students in 2009, I didn't confiscate a single e-cigarette in 2009. 10 years later, it's in the hundreds of confiscated items. And we have a very small student body. Our middle school, high school is 1,300 students. And so when we helped the city council in Hermantown to pass the T21 initiative, we did so by restating a commitment to a partnership that the school has with the city. I'm here on behalf of an entire group of educators who would like you as legislators to partner with us to help us to stem this tide. It's an enormous effort. And in order for us to be able to do this, we're going to need your help. And we're asking you to provide a partnership with us today that will make it harder for students to get their hands on these products. It's an all hands on deck approach. And I appreciate the opportunity that you've given us. I am honored to be a part of this entire group today to ask you for your help in helping us to form this partnership. Thank you.
Thank you. And I think we have last the student group from John Glenn Middle School, Maplewood. And we've got just about 5 minutes because we also have some other students to talk about the two bills that we're hoping to move out of our committee today. So go ahead and state your name for the record, please, and proceed.
Hi, I'm Tony Adelagu. Hi, I'm Siham Abdullahi. And we're part of the school, support our school group at John Glenn Middle School in Maplewood as 6th graders. So SOS meets after school to promote drug and alcohol prevention, including tobacco use. We're involved in the public policy process in the local level, and we're glad that we could speak with the state legislators today. Our name is perfect because we need to shout out an SOS on e-cigarettes in our school. Vapes are a big problem, even in middle school. One day, I saw a kid vape during a fire drill. One of our other SOS members saw a student pass a vape around the class. The teacher didn't even notice. Students vape in the bathrooms too. It's easy to hide vaping devices on your hand, your sleeve. The tobacco industry makes vaping devices that are wearable. It makes it even harder to notice. So this is a vaping hoodie. And then this watch, it's a vape inside of it. And it actually works. And then there's a vaping lipstick with a little hole inside of it. So you could put e-cigarettes in this side of the pocket right here. You can hide it in there. And then you can inhale on one of the strings in the hoodie, and you could do it outside or inside, and you could not even see it. Lots of my friends just want to fit in, and we are curious, and they are curious about new things. We have learned that tobacco and smoking is bad for us, but everyone looks at vapes differently. They think it is cool to vape and they do not know that they're in danger. The vapes come in lots of shapes, sizes, and colors and flavors. They're easy to hide and do not leave an odor. That makes it easy to use without the teachers or anyone else knowing that we're using them. I don't think my friends know that they're being targeted with these devices. They get sucked in by all the fun flavors and they do not know about it. They're addicted before they realize it, and it takes away time and passion from things that we could be doing, like supporting clubs and doing sports after school. We don't know how, but it's hurting our health and our future. Thank you for hearing us kids today Thank you for hearing us today and standing up for the kids.
Thank you so much, ladies. Do any of the members have any quick questions for any of the testifiers we've had so far? Representative Jordan.
I have a question for the student testifiers. Can you say again, Madam Chair, and can you say again what grade you're in?
6th grade.
Thank you.
Thank you, Representative Jordan, and I completely forgot to welcome you to the committee today. We'll have to talk about that in announcements. Thank you so much, ladies, for being so eloquent and telling your story, and I'm sure there may be some people that ask you some questions afterwards.
Okay.
So now we're going to have Representative Edelson come up, and we have House File 3166 in front of us, and I think what we'll do is we'll move that bill before us, and she'll have her testifiers come up, but the testifiers are on both bills, and then we'll move the one bill, and then we'll move the other. So Representative Christensen, Representative Edelson, I'm going to have Representative Christensen move House File 3166 before us to be recommended to be-referred to the Education Finance Division. So Representative Edelson, will you present your bill?
Thank you, Madam Chair. And first, I think we had discussed if it would be okay to be efficient if we could have both House File 3166 and 3164 in front of us in terms of efficiency, but we can obviously vote on them separately to move forward.
Yep, so they're both before us. The ones before us, we'll have the testimony, we'll move it, and then we'll move the other one before us. And since you were going to have the same testifiers, then we'll move that bill. So right now, we have House File 3166 before us. But your testifiers can speak to both.
Thank you. All right. Well, thank you, Madam Chair. Thank you, committee members. I want to thank the Partners for a Smoke-Free Generation that testified before this. Today, I'm glad to speak to two of my bills that are part of a comprehensive solution needed to reverse the e-cigarette epidemic. 3166 requires that we teach one time in middle school, which I think we just heard from our 6th graders, that this has reached the middle school, one time between 6th and 8th grade. And then House File 3164, about the harms of vaping. Because what we're finding out is, to what the students were saying, many students don't fully understand the real implications that vaping has. They have it in cool gadgets, delivery devices that you just wouldn't know that would be so harmful. The second bill is 3164, and this actually, I'm happy to have Cambria, the team before me, Marty Davis, the CEO, created a program at Minnetonka High School, and this bill was developed based on kind of the work that they've done, creating a grant program, but would encourage private partnerships with districts and private businesses first. And if that is unsuccessful, because not every district has, let's say, an Essentia Health or a Fairview Hospital like I do in my district. Not everybody has a Cambria, but Cambria is, as they'll tell you, is kind of expanding out right now. But it would start with a grant of $250,000. I just want to highlight, we have 727 health teachers in the state of Minnesota. We did a survey. I had a working group this summer. We did a survey. 198 of the health teachers responded. That's 27% of our health teachers. We asked them, is formal instruction around health harms of vaping taught as part of your class? 81% said yes. The rest said absolutely not. The other question that was asked, would you be in support of a statewide bill requiring vaping education in schools? 85% said yes. What we know is that schools are on the front lines of dealing with this epidemic. I'm the chief author of Tobacco 21. Representative Baker, I believe that you're my co-author on that. Vaping is an issue, but it's not only an issue for people that are 18 to 21, it's an issue for our middle schoolers. And it's something that I'm happy to have all the testifiers here explain to you a little bit more about why this is such an issue. So Arjun, I could go ahead with my first testifier.
Yes, thank you, Representative Edelson. Go ahead and state your name for the record and proceed.
Good afternoon, Chair and committee members. My name is Arjun Maheshwari, and I am a junior at Edina High School. From school bathrooms to hospital ICUs, the issue of student vaping has grown to the magnitude of a full-blown public health crisis. It has become so ubiquitous that it is nearly impossible to escape. In May 2017, Edina was the first city in Minnesota to raise the tobacco sale age to 21. Since then, 60 other Minnesota communities have passed the same policy. While Tobacco 21 is an important first step, much more needs to be done. That's why last summer I approached Representative Edelson with the bold yet vague idea to address the omnipresent vaping problem that plagues our schools. We assembled a diverse team of students to help draft and advocate for what's now 2 bills as a substantive first step to addressing the problem. With Representative Edelson's enthusiastic support, our student group has consulted with numerous lobbying and interest groups and hundreds of students, principals, teachers, and superintendents across the state. Through the process, we found a vast deficit, like Representative Edelson mentioned earlier, in education surrounding vaping in our middle and high schools. In turn, we have built a coalition of statewide educators and students alike to support these pieces of legislation as a crucial first step to bridge the gaps. Now, some may ask the question, why education? Why schools? The answer is that there's simply a lack of awareness. Students don't know what they're getting into, which is exactly why the only way to initiate further reforms and reactive measures is to have preventative measures, and that starts in the classroom. The only way to empower students to make the right choices for their future is to inform them of the harms in the first place. Ultimately, we need your support and help on these issues. I hope that you will support these 2 bills as a part of a wide-ranging effort to address youth vaping use. By no means is this a panacea to the expansive and complex problem of student vaping, but teachers, students, and hopefully legislators are united in these bills as a solid first step. If we let this problem proliferate unchecked, we will soon have a generation of smokers. If we do not spend time and money on this issue now, we will be paying a far greater cost in the future. Thank you for standing against the vaping industry and making a difference in the lives of my classmates for generations to come.
Thank you, Mr. Maheshwari, which I probably said that wrong. Representative Edelson, if it's okay if we have your next student come up too, just to get the student voices out there, and then we'll have your other testifiers maybe cut their time a little shorter so that we can get to voting on the bills. Please state your name for the record and proceed.
Yes, thank you, Committee and Chair. My name is Andrew Thompson. I'm a senior from Minnetonka High School. So one of the biggest things we've seen, it was throughout my entire high school career, but more specifically in the last year, is a wild vaping epidemic. And so I've seen students not only in bathrooms, in the parking lot, but even to my surprise, in their own classroom, using an electronic cigarette or a vape. And so, I mean, that's affecting students in several different ways. They're getting suspended from school, from clubs, from sports. One of the biggest things that we had in place this year was Cambria's They Lie, We Know campaign. And that was a really effective tool within our school. It wasn't in any way condemning students who vape, but it was just merely a tool that allowed students like me to help inform our peers who do use vapes and electronic cigarettes in our school. And it's really to raise up awareness in the best way that we could, not in a condemning way or anything. But it's just students were uninformed. They didn't really know what they're getting into. Quite frankly, students know that it's bad for them, but to what extent, they have no idea. And so that's what Cambria and the They Lied, We Know initiative was just to inform students, get them the knowledge that they do need. And the funny thing is that students that are vaping, they've never touched a cigarette. Quite frankly, I don't think they ever would want to. and because they know that it had a detrimental effect on the generation before them, but they have no idea what they're getting themselves into. And so that's why I think implementing a system like Cambria's They Lie We Know campaign throughout the state, and then also that's why I'm here supporting Representative Edelson's 2 bills today, is if we get a campaign implemented in schools, not only like we heard earlier, but in middle schools, but also in high schools, that can create greater education for my peers, for my students who I've seen fall to the epidemic of nicotine addiction. And it would just bring better knowledge, and quite frankly, it would lessen the epidemic that we see today. Thank you.
Thank you, Mr. Thompson. And then if we can have the next 2 testifiers take less than 5 minutes so we can try to keep in time. We did start about 10 minutes late, so.
Absolutely.
Thank you. State your name for the record and proceed.
Good afternoon, Madam Chair and committee members. My name is Lisa Smith. I am a high school physical education and health teacher at Lakeville South High School. I'm also the president of the Minnesota Society of Health and Physical Educators, known as MinShape. I'm here today to talk with you and echo everything that we've heard so far. I teach this to my kids, and we go all around. And I told my students today that I was coming here, and they're like, I don't vape, Miss Smith. I don't do that. And I said, good, that's good. But we need to make sure your peers don't. So I'm going to go and do this, and hopefully we can, get some help so we can teach everybody, right? So they were so excited for me to come here today to address all of you. So I really appreciate your time. Today in the United States, there are more than 5 million teens using e-cigarettes. We know that, okay, regularly. And this whole generation may grow up with an addiction problem. And these are my students. These are our future leaders. And we really need to help them. This health crisis deserves urgent attention. In my health class, I cover a range of issues while developing my students' health literacy through comprehensive skills-based health education curriculum that includes mental wellness. I do talk about crisis intervention, CPR, nutrition, relationships, safe media use, right? Health, sexual health, drugs, alcohol, and for years and years and years, we've talked about tobacco. We are in need of the best and most up-to-date evidence-based information to share with our youth about e-cigarettes and vaping. We need it. We know that education cannot accomplish this entire goal, but it is so important, and it is the perfect place to start. I echo these students, and I see it all myself as well as an educator, and it's confusing, and we are all at a place where, what are we supposed to do when we see these students in their cars after school? It's after my contract time. I still knock on the window and I look at them, I'm like, really? I don't know. That's as far as I can go at that point. And it's all about relationships. So I get to have that conversation with them the next day at school, so I am lucky for that. But there is an acute need for this instruction, and it's simple for us to integrate this life-saving information in our schools and in my classroom. So I really urge you all, please support this bill as a part of a comprehensive effort to help youth avoid tobacco in education. Thank you.
Thank you, Ms. Smith. Then we have one more testifier, and then we will go on to questions on the bill. Please state your name for the record and proceed.
Sure. Thank you, Madam Chair and committee members. My name is Sarah Leon. I am a marketing director at Cambria, but more importantly today, I'm here as a parent of 3 high schoolers, a freshman, sophomore, and a senior at Minnetonka High School. Last year, a group of us parents at Cambria, we found ourselves discussing the dangers that obviously have been brought here today of vaping and the worry that we had over how it was impacting our kids and, quite frankly, our families. What pushed our anger over the edge, what we've talked about here today, of course, was the fact that Juul and other companies, other big tobacco companies, were downright lying to us and to our kids through ads targeting the youth, making them think that e-cigarettes was safe. As a company, I'm very fortunate that we decided to take action. We quickly launched a peer-to-peer education campaign that we called They Lied, We Know, for obvious reasons. Our goal was to give high school students the tools to educate their peers because, quite frankly, kids, like my kids, they don't want to hear parents like me or other adults talk to them about this. They will listen to each other. We made an impactful video. We created a kiosk environment where the kids could talk about this issue in schools. We launched a website, theyliedweknow.com, and a social media campaign and created an educational brochure. We created a plan to get a group of students on board to lead this change. We educated these kids, and we spent 5 weeks in the school handing out T-shirts, giving quizzes, having the students sign pledge banners, and spreading the word of how harmful e-cigarettes are for their health. Since the beginning of 2020, we also brought our program to St. Peter High School, and then we are quickly moving to Mankato East, Mankato West, as well as New Prague High School and middle school. Our goal is to bring They Lied, We Know to 3 to 4 additional schools before the end of the school year. But unfortunately, Cambria can't solve this problem alone, which is why we are here today and really fighting for additional measures and assistance to fight this battle, including, of course, Representative Edelson's 2 bills that have been discussed today. These proposals will ensure every Minnesota student receives clear information about how the dangers what the dangers of e-cigarettes are and how life-threatening they can be. We look forward, and hopefully you ensure a platform where this conversation can continue to spread throughout our state. Thank you.
Ms. Lean. And then just to remind members, we have House File 3166 before us right now on the vaping awareness and prevention instruction in middle school. So if we could limit our questions to that, or unless you have general questions for the testifiers, so we can move this bill and then we'll go on to the next one. I have Representative Scott.
Thank you, Madam Chair. And I have a question. Representative Edelson, you mentioned that with the survey that you did this summer that I think you said maybe 81% of the respondents said that they were doing something, they were teaching something on vaping. And so I'm wondering if you have data on, and I know it's really early in the game with this whole vaping thing, but do you have any data that shows that that education is actually being effective?
Representative Edelson.
Madam Chair, Representative, what we know from the 81 that responded, 81% of the teachers that responded, they said that there was inconsistency. They were coming up, they were doing research on their own. There was nothing that they felt like they were getting a comprehensive package on what to teach their schools. What we know is we've seen since 2016 the number of middle school students double on who are vaping, and we haven't said, hey, schools, let us help you with that. To my understanding, that has not happened. And, we have lots of people trying to figure out how do we deal with this epidemic.
Representative Scott, follow up.
Yes, thank you, Madam Chair. And Representative Edelson, are there other states that have implemented a statewide education program? And if so, what have their outcomes been?
Representative Edelson.
Madam Chair, Representative, that's a good question. This actually came from Student Voices, so I haven't checked into that, but we did do all of our research on making sure that we touch base with everybody here in Minnesota that counts in our state, from superintendents to Education Minnesota to all of this, touching base with health teachers. We know it's a problem here. I don't know if it's been impactful, but I do know that you've had some results with Cambria in terms of changing the culture at their schools. So Essentia Health has also launched a program near Duluth, and they've actually seen some results. So we do have private organizations that are launching programs and seeing some changes, but again, I think it's too early to tell right now.
Thank you.
Okay, Representative Erickson.
Thank you, Madam Chair. And to Ms. Smith, thank you. And thank you to all the testifiers. This has been very interesting. But does your school, or do you also teach that we have 3 chapters of law that make violation of what's happening in your schools illegal? So you teach the indoor you teach the Indoor Clean Air the Indoor Clean Air Act. So students know that's a violation, and then High School League, of course, is a violation. And we also have Chapter 609, which prohibits, it makes it a misdemeanor. So those laws are taught, correct?
Ms. Smith?
Yep, Madam Chair and committee, yes, absolutely, those laws are taught, and students do understand. We have students who are in violation more than they should be.
Yeah.
So they are aware, and if they aren't, because they haven't had health class yet, they are quickly learning from their peers.
Representative
unfortunately.
Erickson.
So, Ms.
Follow-up?
Smith,
Representative
so there's
Erickson?
nothing posted in your school that you know of that would set down these 3 specific chapters in law that would outline for the students that they are doing something illegal and subject to a law enforcement or to penalty. Is there anything
Ms.
that's
Smith?
calling their attention to that?
Madam Chair.
We're going a little far
I
off
just don't know exactly
field,
what I'm
so.
supposed to address you again?
Yeah, you
Okay.
address her.
Yes, Madam Chair, and committee. No, there is nothing that I've seen posted with the legal verbiage. There are all kinds of pieces about vaping and, going into the bathroom, as there's a lot of signs going into the bathroom that talk about the health effects, of course, but the legality pieces are not posted.
Thank you.
Representative Edelson.
Madam Chair, Representative, I guess I would also, where is the criminalizing kids with misdemeanors because they've been targeted by tobacco companies doesn't really seem like the solution. I mean, I get that we want these kids to stop, but I don't know that criminalizing kids is the right answer. I think we should really hold big tobacco accountable here for what they've done. I mean, where's that lipstick? I mean, that's not for me. That's not for a 38-year-old woman.
But it is the law.
Representative Erickson, did you have a follow-up comment?
No, it is the law. I just wanted to make sure they understood the law.
Thank you, Representative Erickson. Before we move to, is there anybody else in the audience that wanted to testify on this bill? Seeing none, I renew the motion that House File 3166 be recommended for re-referral to Education Finance. Any further discussion on the motion?
Madam Chair?
Yes, Representative Erickson.
So this particular proposal should go to government operations too, because it involves both the Department of Health and MDE. Is it your intention to let Representative Dabney know that this should also be done?
Representative Erickson, Representative Dabney is the only one that's approached me that wants it because we know there's a small fiscal note coming, but that's a discussion we can have in Ed Finance.
Yeah.
Representative Edelson.
And Madam Chair, for the vaping youth, the e-toolkit that we're mentioning that schools can reference here for middle school and high school actually already exists with the Department of Health, so nothing needs to be created on that.
Thank you. Any further discussion on the motion? Hearing none, those in favor of the motion say aye. Aye. Those opposed, nay. The motion prevails. House File 3166 is recommended for re-referral to the Education Finance Division. Next up, Representative Edelson's House File 3164. And Representative Christensen, will you move House File 3164?
So moved.
Representative Christensen's moved that House File 3164 be recommended for re-referral to the Education Finance Division. Representative Edelson, since you've had your testifiers talk already, do you want to just briefly explain what this bill does?
Yes, Madam Chair. This bill appropriates $250,000 for grants, kind of like what you've heard that Cambria has implemented, allowing schools, and the Department of Education would really have to break this up on how much the schools are going to get per program. But it would encourage alternatives to suspension because one of I mean, I don't know about many of your districts, but I would ask your superintendent, how many of your suspensions are because of vaping-related incidences? And I would tell you in Edina, it's almost all of our suspensions in Edina are because they were vaping in schools. So it would give dollars to have again with the toolkit from the Department of Health to allow schools to do peer-to-peer creation of a program to really change the culture at their schools. I mean, I think Angela, you had said it best. They lied. Big Tobacco has lied to our youth, and I think that we need to make sure that we're educating our youth on that they've been subject of a campaign that targets them, so now they can create their own campaign.
Thank you, Representative Edelson. Does anybody have questions for Representative Edelson on House File 3164? Representative Scott.
Thank you, Madam Chair. And Representative Edelson, my concern here with this is the fact, what you said of these suspensions being from vaping-related offenses. And my concern with going light on this is, and I think it has to be maybe specified further in the bill, but there are other things that these kids are vaping besides tobacco. And so if they're putting in, and a lot of these cartridges on the, I don't know if you call it a black market or whatever you call it, have other things in them, THC, and my understanding, I don't know, but my understanding is a lot of these kids and some of the deaths that were occurring from this was that they were vaping things that weren't intended for the cartridge, how the cartridge is made. And so I certainly don't want kids coming in and using a vaping device to smoke to vape marijuana, for instance, and then just get a slap on the wrist for doing that while they're in school. So I don't know if that's anything that you've thought about, but I'm interested in your reaction to that.
Representative Edelson.
Thank you, Madam Chair. Obviously, that's a complicated issue, and you're absolutely right. We know that youth are using like a marijuana juice of some sort, and they are getting very sick from that. Absolutely, the alternatives to suspension would be an alternative way for punishment or to be held accountable on that. But at the same time, I mean, we can hold students accountable without having them, miss school for 3 weeks. I think that there's ways to say we don't tolerate that at our school, but also, I mean, we're talking about what is the end result? What is the end result that we want to see with these kids? I guess I would just question that in terms of, I would put that to all of us. I mean, if that kid is using that substance, let's hold them accountable, but not have them not be in school for 3 weeks. I think that's an okay thing to ask.
Anybody else have any questions? Is there any other testifiers in the audience? Seeing none, I renew the motion that House File 3166 be recommended re-referral to Education Finance Division, House File 3164, said I was out of practice, be recommended for re-referral to Education Finance Division. Is there any further discussion on the motion? Hearing none, those in favor of the motion say aye. Aye. Those opposed say nay. The motion prevails. House File 3164 is recommended for re-referral to the Education Finance Division. Members, quick announcements. First, I want to welcome Representative Jordan to the committee. As you notice, Representative Hewitt things shifted. And I know we're over time, but I'd like just 1 minute for Representative Jordan to be able to introduce herself, and then I've got a few quick announcements, then we can be done.
Yep. Hi, everyone. My name is Sydney Jordan. I was elected in a special election a few weeks ago to represent Northeast Minneapolis and Southeast Como, and education is one of my big passions. I'm especially passionate about Minneapolis public schools, so I'm excited to be on the committee.
Thank you. And then announcement, we have, of course, committee tomorrow at 2:30, our regular time. Due to precinct caucus break, the committee will not be meeting in the afternoon on Tuesday, February 25th. But fortunately, Chair Davney from Ed Finance has agreed to let us have his space and time from 9:45 to 11:15 that day on Tuesday, February 25th. And that was the time we were scheduled to talk about the bill we read, or the book we read this summer, and to have some informational hearing from District 287 on the work they're doing on trauma-informed education. So we will be doing that on the 25th. And then, yes, I think that's all I had to announce. That, and also mark your calendars, and I think we already sent this out in an email. We will be meeting on Friday, February 28th, starting at 9 a.m. And then I think you will also be receiving, we sent out an email for you to mark your calendars. We still don't have details on what time and location, but the Education Finance Committee, actually all the education committees, are going to be having a symposium to discuss the opportunity gap in Minnesota on March 6th. So with that, this meeting is adjourned.